Hey everyone, welcome back to Med-Surg Knowledge Nuggets, where we take big nursing topics and break them down into manageable, test-friendly content. Today we're talking about folic acid anemia. So folic acid anemia is one of the causes of macrocytic anemia, and this is where the red blood cells become larger than normal, and you'll see this under a microscope, and you'll definitely see it in clinical practice. So let's start with a quick review of folic acid, which is also known as vitamin B9. So folic acid is a water-soluble vitamin, which means we need to consume a steady intake because we can't store large amounts for long term. What we do store, it is kept in reserves in the liver and the blood. So you may hear the terms folate and folic acid. So folate is the natural form found in foods, while folic acid is the synthetic form that we use in supplements and fortified foods. So many use these two terms interchangeably. So folic is necessary for DNA synthesis, cell maturation, cell replication, and protein metabolism. And it's especially important during periods of rapid growth like fetal development and infancy, which is why folic acid is so heavily emphasized during pregnancy. Folate is absorbed mainly in the jejunum, as you can see pictured here, which is the middle section of the small intestine. So what can cause folic acid deficiency? Well, there are several common culprits. So the first one would be dietary deficiency. This is when the person is just not eating enough folic acid in the diet. And this is especially in people with poor intake of fresh fruits and vegetables. Then we have malabsorption syndromes like celiac disease. So these patients could be eating enough, but they're just not able to absorb it. Certain medications, including methotrexate, oral contraceptives, metformin, and some chemo drugs, can also affect the absorption of folic acid. Increased requirements during pregnancy or periods of rapid cell turnover. So, when you're pregnant, you're literally making a human being. And during the toddler years, infancy, there's a lot of growing happening. So the body needs more of these essential nutrients like folic acid. So if the person isn't taking them, then they become folic acid deficient. Loss during hemodialysis. So as the blood travels through that machine, these patients lose folic acid. So you'll see that many dialysis patients are also on a folic acid supplement. Alcohol use is a big contributor, and here is why. So chronic alcohol use often leads to poor nutrition and malabsorption. So if you are drinking a lot of alcohol, you're probably not eating a lot. Instead, it's being replaced by alcohol. So alcohol directly interferes with folate absorption, and alcohol also shortens the lifespan of red blood cells to about 60 days. Remember, our red blood cells are usually alive for about 120 days, so this is half of that lifespan. The alcohol can also damage bone marrow stem cells, which will lead to pancytopenia, which is a decrease in all of our blood cells, including red blood cells, white blood cells, and platelets. So what are the signs and symptoms of folic acid deficiency anemia? So patients will present with general symptoms of anemia like fatigue, weakness, pallor, and shortness of breath. And here's a tip. Neurological symptoms are rare in just pure folate deficiency. If a patient has a low folate level and the patient has neuro symptoms, then we should start thinking that they also might have a vitamin B12 or possibly a vitamin B1 deficiency. In patients with alcohol-related folate deficiency, you might also see signs of pancytopenia, which will increase the risk of bleeding and infection. Diagnostics. So we're going to draw labs and we are going to see decreased folate levels, usually measured after fasting to make sure it's accurate. We'll see normal cobalamin levels. This is also called vitamin B12, and this will help differentiate between vitamin B12 and vitamin B9 deficiency because their signs and symptoms are very similar. And we're also going to see low hemoglobin levels. It's also worth noting that folate and B12 deficiencies often coexist, meaning that the patient might have both. It's very common to see both, especially in patients who are malnutrition or with those with chronic alcohol use. A big difference to remember though, neurological changes in folate deficiency are usually reversible, whereas vitamin B12 deficiency, they can actually become permanent if not treated early. So how do we treat folic acid deficiency? Well, first we're going to encourage the patient to eat folate-rich foods. This includes leafy green vegetables, citrus fruits, beans, lentils, fortified cereals, and organ meat like liver. So most patients will also need folic acid supplementation, especially if they're pregnant, have a history of any type of GI surgery, use alcohol heavily, or take medications that interfere with folate absorption. Pregnant patients need special attention because folate deficiency can lead to serious fetal neural tube defects. Children under 1 year, patients on dialysis, and patients recovering from malnutrition also need to be carefully monitored and also given supplementation. So with this deficiency, patient education is key. We're going to teach them to report any signs of worsening anemia, like increasing fatigue or shortness of breath. That's very important to remember. We want to also let them make sure that they understand the importance of dietary sources of folate and why supplementation might be needed. Know that also large doses of folic acid can turn urine a bright yellow or dark yellow, and this is normal and not a cause for concern. As nurses, it's really important to make sure patients understand potential side effects of medications because they might get scared and they might end up in the emergency room or doctor's office unnecessarily because this is an expected, something expected, if you take large doses of folic acid. Nugget on folic acid anemia. So to sum it up, folate is crucial for healthy red blood cells and cell growth. As nurses, we need to recognize who's at risk, catch the signs early, and provide patient education on diet and supplementation to help prevent those serious complications. And thanks for watching. If this helped clarify things for you, make sure to like, comment, and subscribe for more Med-Surg knowledge nuggets just like this one. See you in the next video.